Hello and welcome to this edition of Your Health, Your Wealth. I'm your host, Dr. Eddie Patton, and today I'm going to take a little bit of a different spin, and I want to talk about or review some highlights from a recent meeting that I attended. Today wrapped up the 2026 ACHE Congress. This is a meeting of healthcare leaders, and I gained a lot from this meeting, learned a lot about kind of future trends in healthcare, where things are going. So I thought it would be a good idea, since this is still fresh on my mind, to give you, the listeners, an outlook on healthcare moving forward, particularly from the standpoint of leadership and executives in healthcare. So sit back, relax, and we're going to talk about hospital finance. I'll give an overview of some of the hot topics, at least in my view. This, of course, is not endorsed by ACHE or anything else. This is just me telling you a little bit more about what I learned about the future of healthcare, and more important, how is healthcare going to be governed and how that's going to impact each and every one of us as we navigate this system. I want to give a little bit of basics of what ACHE is. It's the Academy of Healthcare Executives. So every year they do this Congress where they bring about all of the healthcare leaders from CEOs, CFOs, chief financial officers, chief nursing officers, chief medical officers, medical groups, and rising or early stage leaders in healthcare. And they come together and talk about problem solving in healthcare. There are over 200 sessions. There are big stage keynote speakers and workshops as well. So it was a good experience for me to take a step back from the clinical standpoint, or looking at things from a clinical standpoint or from a physician standpoint, to looking at how things are going to be governed from a leadership standpoint. As you know, there's the practice of medicine. That's everyday, frontline, boots on the ground, taking care of people. But there's also the healthcare administration. And so within this organization, it brings together the best and the brightest in healthcare leadership to talk about a lot of these issues that we're going to be dealing with. And it also gives a good overview of where things are going and things to look out for. So let's talk about just a few key things that I took away from this meeting. So the first big theme that I took away was that the economy and the strategic outlook on healthcare varies differently depending on who you ask. I attended a number of sessions that talked about everything that's going on in our society and how that's making its way or matriculating down into healthcare. You look at things like the economy, labor costs. Labor costs are up, supplies and drugs are more expensive, and reimbursements are down. So how can insurers and the government, which is a larger insurer, how does that keep pace? And what does that mean for hospitals, particularly who are the main providers of healthcare, large groups, moving forward? One other thing that I've been really keeping an eye on, and I think we all should keep an eye on, is rural health or rural hospitals. And a lot of small rural hospitals are shutting down, unfortunately, because they aren't able to keep their doors open to take care of people because of some of these financial constraints. So if larger hospitals in larger cities like Houston, Dallas, New York, LA, if these hospitals are operating on such thin margins, meaning the amount that they're bringing in, they're having a hard time paying their labor force, keeping the lights on, paying the bills, thin margins to operate on. Imagine what that is doing to rural hospitals, smaller hospitals in smaller towns. But how that boils down to the everyday person is that you may have to travel further to get medical care. We see this in neurology in the form of the mobile stroke unit, where now we have these ambulances, specially equipped ambulances, that can actually go out into the community and do a CT scan and provide medications for stroke, and then take that patient into a larger city. We get spoiled. I'm in Houston, the largest medical center in the world, and so you can get spoiled at the availability of healthcare that we have here. But when you think of smaller towns, 60, 70, 100, 200 miles away, that time period could be life or death between that patient getting somewhere to get the help that they need. So that's something that we need to think about as we move forward in this economic climate. If rural hospitals continue to close, and if we don't address this issue of coming up with the finances and the things that rural hospitals need, what is that going to do for care in these communities, which, unfortunately, these tend to be the communities where people need the greatest amount of care. There are less primary care doctors, less physicians available for people to get routine checkups and so forth. So you're dealing with more of that category, again, of catastrophic care. So they need the resources and the place, the availability to have a hospital in the community to be able to help them. So that's something we definitely need to look at, and how, from a policy standpoint, these things are trending to make sure that we keep these rural hospitals open and we're able to take care of people out there in the community. Some of the other terms which we've talked about before, narrower networks are steering toward different providers. So more of this consolidation in healthcare, higher deductibles and copays, as employers and insurers are managing their own costs and dealing with this economic climate. That's being passed down to the consumers in the form of higher deductibles and copays. And I want to go back to that consolidation issue, where these local hospitals or medical groups are being acquired by these larger systems. And the way in which that can decrease access to care is that sometimes when you are employed by one of these systems, you can't work at other hospitals. Most of these small rural hospitals are being manned, or the providers are community docs. But as more and more of these groups consolidate under larger groups, that limits the access that patients have. So we'll talk later about what we can do to navigate that. But the headline is clear that leaders are under more pressure to do more with less, and that this tension is shaping the care environment that most of us experience and that we feel every day. A second big theme that I took away this year from the meeting is innovation, and especially AI. I am optimistic about AI in healthcare, right now at least, and where we're going with this. It's not a buzzword. It is something that definitely is taking hold within healthcare, and digital health is a real thing. And hospitals and large systems and those that deliver healthcare on a large scale are trying to figure out how to deal with this. Health systems are looking at AI to reduce documentation on clinicians through so-called ambient listening tools, dictation tools. And this is changing the workforce in how we're doing dictations and getting that done. Improving throughput, getting patients through the emergency department and hospitals more efficiently, using technology and AI to do things like help with scheduling OR times to make sure that there's the best available or more optimal use of the OR suites. And even within the emergency room, trying to help triage patients to see, who needs to be seen first, who might need to be admitted, and who can maybe wait a little bit longer. So they're looking at predictive tools to enhance safety, and they can flag high-risk patients before problems escalate. This is a pretty exciting thing. I've seen some of these tools, particularly in the intensive care unit, that can look at different things like your vital signs or different things like that, and try to predict when a patient is starting to decline, even before they're showing a lot of the signs and symptoms that we're used to looking at. And then personalized communication and follow-up when it comes to chronic disease management. Chronic disease management is one of the most expensive things in healthcare that's driving up the cost of healthcare. And if we can use technology and AI to intervene in those situations, we can hopefully decrease or drive down some of these costs of chronic care. So these trends I'm personally constantly following, not just in large urban medical centers, but also in rural centers, critical care access, how we best use telemedicine, telehealth, mobile health units, like I talked about the mobile stroke unit, and how AI is making its integration. I was just in DC lobbying for expanded use of telemedicine, and maybe in situations like getting into the rural communities, telemedicine can really help. So for all of us, AI and tools can have a double-edged sword, but in the best case scenario, hopefully these digital tools will help make visits smoother, shorter, reduce errors and unnecessary tests, and help us manage these chronic conditions and hopefully save money over time when it comes to the healthcare system. We are a long way from AI and technology doing what physicians do or taking over for physicians. But what we can do is to continue to see how artificial or augmented intelligence can help clinicians do their job better and more efficiently. And when we do that, we can increase outcomes when it comes to healthcare. So healthcare leaders have a task on their hand in really figuring out how to integrate this technology and the cost analysis to see if the return on the investment is worth it with using this type of technology to build up their system. The third big theme that I'll mention is workforce strain, which is still at the front and center of healthcare. There were several sessions about recruitment, retention of workers, but most important about building a culture of resiliency within the workforce. Burnout among those taking care of patients like nurses, physicians, support staff, it's still a big issue, and it creates a safety issue. It creates a quality issue and ultimately a cost issue because of turnover and temporary labor, which is skyrocketing because of burnout. There was one session that I attended in particular that I really, really enjoyed about brain health. And it was about, as a leader in healthcare, along with looking at the ins and the outs and crossing the T's, dotting the I's, and looking at productivity within our departments, but are we actually paying attention to workers and employees to see how is their mental health doing? Are they sleeping enough hours? Are they, meditating? Are they doing things to take care of themselves mentally? Because over time, this brain health load, if it's not properly addressed, can lead to higher mistakes. And these mistakes can be costly and can even cause injury, harm, even death to patients. So really taking care of people and the workforce is an important issue. One thing I did appreciate about the ACHE meeting was there's a strong emphasis on leadership development and equipping these managers and executives with the tools that they need to navigate this constant change, to deal with these issues when it comes to workforce and everything else. A couple of other things that were highlighting: supporting young physicians and staff entering the workforce, particularly during these pretty turbulent times, whether you look at the things that are going on within the government, the economy, and everything else. Building a psychologically safe environment for people to speak up when they have problems, making diversity, equity, inclusion concrete in hiring and promoting and care delivery. And when it comes to the workforce, just building a culture that puts patients first. So as a patient, when you look at the culture of an environment, what you want to think about is, how long have I been waiting to be seen? Do I feel rushed or attended to by my care team, or are they just trying to push me through the system? And how likely is your clinic to have constant staff that know your story. So this turnover, those type of things impact patient care and impact patient retention if there's constant turnover of staff. The staff seems burnt out, inattentive, or not locked in when it comes to really adhering or paying attention to patients. So as healthcare leaders, it is vitally important that along with looking at the detailed information that we look at when it comes to, like I said, the productivity of a department and how people are doing, we need to really pay attention to the well-being of employees, because when those employees are happy, that attitude, that culture is infused into the patient care. I've always, and for a long period of time, whenever I had new employees or whenever we had staff to come in, I would say, listen, the visit starts with the phone call. When the person calls the office, who do they get? Or do they get a warm, smiling person saying, hello, can I help you? Do they get a recording? Or do they get someone that has an attitude? Because if that happens, then they get to the office. When they get to the office, who's at the front desk? Is that person greeting them with open smile? Do they make sure whether they need water or something to attend to their needs? So all these things happen. And then when the MA, when they're rooming the patient, what's that experience? So by the time that I go to see them as a physician, this patient has already had 4 or 5 touch points throughout the system. And depending on if those touch points were good or bad, I usually know when I get into the room, depending on that patient's attitude, I either have to use time of the visit trying to diffuse that, ask them, hey, how's your experience been so far? Or it can make for a much more pleasant physician-patient visit because this patient was taken care of all along the way until the point that they got in to see me. So let's bring this down to a more personal level, and some of the things that I've been mentioning and the takeaways from this meeting and what it means in real life to real people. And when you hear about these financial pressures and AI adoption and workforce challenges, what does that actually mean to your own health? And what does it mean when it comes to the practical nature of healthcare and how we're delivering it? Well, first of all, we look at coverage and premiums. Hospitals and insurers respond to the rising costs in society, inflation, all of these factors, macroeconomic factors, have a play in healthcare. And the hospitals and insurers have to respond to that, usually through higher premiums, deductibles, cost sharing, where some of those costs are trickulated down to the employer plan or the individual coverage. And it becomes more important than ever that you understand your benefits package, you understand your in-network providers, and take advantage of the preventative health things that are covered under your hospital plan. The other thing is access and convenience. Investments in things like telehealth, patient portals, remote monitoring can save you time, sometimes money, but you need to know how to use them appropriately. If your health system offers virtual visits or remote programs for chronic conditions, consider whether to enroll in these, because this could save you a lot of resources later on in the future in things like missed work, transportation costs, and so forth, and avoid emergency room visits by taking better care of your chronic care condition. So if those things are available, definitely utilize them. From a quality and safety standpoint, when organizations deploy things like AI to flag risks or standardize care, the goal is, of course, fewer complications and fewer unnecessary hospitalizations. For you, that can translate to better outcomes, lower long-term costs, especially if you have chronic conditions like diabetes, high blood pressure, heart disease, or asthma. Those things where monitoring is so important. And advocacy and planning. So in a system under pressure, being a passive consumer can be expensive. So you need to be more active in your health care. Prepare for your visits, asking about lower cost alternatives, requesting estimates, and setting aside savings for healthcare expenses all become part of protecting both your health and your wealth and setting yourself up for a future where you can better navigate this healthcare system. So one simple exercise is look at your last year of healthcare spending, look at your premiums, your co-pays, your prescriptions, over-the-counter items, and ask, what's one thing I can do differently this year based on how the system is changing? And what might be scheduling overdue preventive screenings or switching to generics or using virtual visits when appropriate? How can that have a positive impact on my health and ultimately my wealth as well? There were a number of great sessions this year that I attended looking at things like the economy or the effect of inflation, spending, and all of these factors on people. There's a overall decreased confidence of people in the economy, and this is increasing stress and causing a problem when it comes to healthcare and leading people to make certain decisions like whether to pay rent or pay for their prescription drug medications. So overall, healthcare leaders have a tall task when it comes to navigating this system. But as I wrap up and we talk about those three takeaways, first, that healthcare systems are under intense financial and workforce pressures, and this tension is shaping everything from services offering to you and also your out-of-pocket expenses. We also talked about AI and innovation and how this movement into AI, there are some challenges, there may be some issues that it may arise regarding cutting workforce in some areas, but if it's implemented thoughtfully, carefully, and equitably, this may be a way in which to really help our healthcare system. And third, leadership and culture matters. The way that organizations treat their people and invest in the development ultimately affects the quality and reliability of the care you receive. I am a big proponent of culture. Culture starts at the top and it matriculates down all the way to the patient-physician interaction. And it's important as leaders in healthcare that we work on culture and we figure out how to make sure that people don't feel like this is a drive-through service and that we are attentive to their need. And part of that is making sure that your workforce is attentive and making sure that the workforce is not burnt out and is supporting, they feel supported as well. So all of those tools, coming together can help build this culture and this workforce and this healthcare environment that'll lead to better outcomes ultimately, in my view. So think about different ways in which healthcare is touching your life, different ways that it may be impacting things like rising premiums or how digital health or longer wait times even may be affecting how you're getting healthcare. And then think about the changes that we need to do to make this system better. ACHE is a great organization. We talked about some heavy issues during this Congress over the past 3 days. It's not going to be an overnight fix, but I do think, and I am optimistic that over time we'll be able to tackle some of these big issues in healthcare and really make a positive impact on healthcare delivery moving forward. I hope you've enjoyed listening to this edition of Your Health, Your Wealth. Please download it, share it with others, write a review, give me your feedback. And as always, I really appreciate spending this time with you. And until next time.